So let's give a warm welcome to Mary Ann and Dr. Boone.
Many of you already know Dr. Boone, but let me tell you just a little bit about her. She was in private practice in Atlanta for 35 plus years, one of Atlanta's top docs for more than a decade. She was one of the first female board-certified urologists ever. She is an absolute expert in the subject of urology, but one of the many things that is so amazing about Dr. Boone to me is her ability to tell a story. And if you haven't read her first book, we have it on sale here too. It is absolutely amazing and riveting, and you won't be able to put it down. But when she wrote about urology, and I knew this book was coming out, I thought, well, this isn't going to be quite as interesting. Let me tell you, it is. The story she tells, I mean, for someone to have the medical expertise that she has, but also the storytelling ability is simply amazing. And you'll find out more, because I want to let Dr. Boone speak. But the last 5 chapters of this book could be a book in itself. So what I'm saying is anyone, whether you have interest in urology or not, if you have urological issues right now or not, it's still a very valuable book on managing your own health and on managing your life. I just think it's an extraordinary book. Dr. Boone, thank you so much for being here with us, and we're very excited to hear from you. I want to start out by saying what you all know, that she is very well respected in her field, and as evidenced in part by the many dedications in the front of the book from other doctors. But what intrigued me, Dr. Boone, very much was your personal dedication of the book, and I'd like for you to share with the audience what that dedication means to you and why you placed it.
Thanks everybody for being here. I'm very humbled. Like Anel said, I know on Saturday afternoon there's a lot of things you could be doing, and I really appreciate you being here. So to answer the question, anybody who knows anything about medicine knows that it's a team sport, and particularly in the operating room. Nothing happens unless you have good anesthesia. In our particular situation, I needed good radiology, good nurses, and good techs. And I've been blessed throughout my career in the many places that I've worked, and I've lived in multiple cities and worked in multiple hospitals, to have great teams. A number of the nurses from Northside are here today, if you guys would raise your hands. These are the real heroes in medicine. And I think we all saw during the pandemic how important they are. A lot of the doctors closed their offices, but the nurses stayed on duty. So I honor them as the real unsung heroes of medicine. And that's the reason for the dedication. Thank you, guys.
At least one of the people attending today walked up to me and said, I said, how do you know Dr. Boone? And she was a patient, and she said, Dr. Boone saved my life. And I'm almost going to cry when I say this. I never really thought about it, but on a regular basis, your work saved lives. And you did this for 35 plus years. Why did you decide to leave that, for the time being at least, and write? What was the impetus there?
So I've always loved to write. I started writing when I was about 6 years old, and I would keep journals. I kept them forever. And I've written to process my emotions. When I was a surgery resident at Charity Hospital in New Orleans, a lot of really horrible things happened. I worked in the accident room, and we had a lot of gunshot wounds and stabbings, and on a daily basis it was pretty scary. We saw the sickest of the sick, and so a lot of times the emotions would happen so fast that you couldn't process them, and so I would write things about them. And one of my mentors that I talk about in my first book was Dr. Norman McSwain. And he encouraged me after Katrina hit Charity Hospital and destroyed it as a hospital forever, to take the stories I'd been sending to him for 20 years and turn them into a book. Now for this particular book, it's basically a love letter to my patients. And the reason I quit working, it was kind of almost an accident. I had decided to take a year off to travel because I noticed that multiple friends of mine were coming down with diseases that were basically keeping them from being able to enjoy their older years. And so I decided that I would take a year off and travel and basically take a sabbatical. And we had all of our travel time set up, and all of a sudden COVID hit. And so after the third time that we rescheduled our travel, as many people experienced, I decided not to go back. I decided that I had given my youth and most of my life to medicine, and I wanted to spend some time traveling and doing other things and writing.
One of the reasons you're all going to love this book are the stories in the book. She gives a lot of very practical medical information, and it's organized by chapter, so you can look, at your particular issue, and she gives you concrete information. But there's also these great stories, because Dr. Boone is a consummate storyteller, as you'll know if you've read The Big Free, and I hope if you haven't, you'll buy a copy of that as well. So I wanted to ask you, because I've got my own, of course, favorite stories in the book, but what is your personal favorite story that's in the Unfettered Urologist?
So I see one of my gynecology colleagues in the audience, and I think she'll probably like this one. She's probably had this happen to her. But in the chapter where I'm talking about 3 doctors as one, the last 10 years it became evident to me that the older people, the people over 70, 75, what they were looking for was an expert. They wanted you to come in and tell them what to do. They weren't interested in second opinions for the most part, unless they had a complex problem, and they didn't really want to try to figure this out on their own. Then my age group, the baby boomer people, they wanted a trusted partner. They saw you as a professional, like their tax guy or their lawyer, and they felt like it was their body and they were going to make the final decision, but they trusted my education and they wanted my input. And that group of people would frequently, well, not frequently, but would sometimes ask for a second opinion, and so we had more of a partnership. And then there was the younger generation. They would come in with an inch-thick research project that they had done off of Google. They had diagnosed themselves, and they had decided what they wanted, and if I did not go point by point from their Google study, they would walk right past my 17 diplomas and go into the waiting room and put a negative review on the internet, because I didn't do what Dr. Google said. And that was a big shock for me. So I'm going to read just from that chapter for you, and this won't take too long, so try not to fall asleep. Before I'd fully realized my need to be 3 doctors in one, I had a few shocks. One day I was performing a vaginal exam on a 22-year-old who clutched her phone as I explained what was going to happen. I don't know when everyone began clutching their phones, but I was familiar with the behavior. It reminded me of a pediatric patient holding their favorite doll or bear for comfort. People her age held tight to their phones at all times. I thought nothing of it. When I was sure she was comfortable with the planned pelvic exam, I moved to my rolling stool to position myself between her legs. My nurse, who's I think sitting in the audience, made ready the ubiquitous KY jelly. I was gloved, sitting at eye level with the entrance to her vagina and completely focused on discovering the cause of her urethral pain. I explained what I was going to do before I did it, and she seemed relaxed about the experience. As I pulled my gloved fingers out of her vagina, her crotch exclaimed, "What did you find, doctor?" Entranced in my deep focus on the source of her problem, I imagined her vagina was talking to me. I was so startled that I pushed back too quickly, jammed my rolling stool against the wall behind me, and slammed my own head into the wall. As my head bobbed back into position, the vagina continued to talk, as if nothing strange had occurred. When I gained my composure, I realized that this young woman had me on FaceTime with her mother. Her mother had been watching me perform a pelvic exam on her daughter. I was speechless. I felt disrespected and violated. I was no longer the trusted expert. Without realizing it, I had become a new kind of doctor, and the expectation of me was nothing that I understood.
So there are a lot of stories like that. There's also, I will say, my husband just grabbed this book from me when I put it down, because he said, "I've got to know." He said, "I think in the last few hours you've laughed raucously and then you've sobbed hysterically," because there are also sad stories in the book, and it's just very, very moving. One of the, your 3 doctors and the phone talking to you brings up, because you talk a little bit about being an informed patient in the book. What do doctors base their recommendations on, and is it smart for us to Google before we come see our doctor or not?
So I think it's very important that we all kind of take control of our own health to some degree. But you also have to realize that you don't know what you don't know. And sometimes the people with the fanciest websites are not necessarily the best doctors. You also can't believe all of the reviews. You know, if you see a pattern where everybody's complaining about the same thing over and over and over again, then maybe you can trust that. But if you see a few truly negative reviews, you have to realize a lot of times it's because we don't give them what they want, or they're upset with their bill. And you know, we're humans. I mean, sometimes we're not having a great day either. So I would kind of ignore most of the reviews. As far as figuring out what's wrong with you on Google, if you go into the doctor with some background information off of a good site, and on my website under the Unfettered Urologist, I've listed a bunch of references of places that you can go. And it's the typical places you would think of, like the Mayo Clinic, the Cleveland Clinic, WebMD, a lot of those places. But if anybody's trying to sell you something, you might want to be a little careful with their website. I mean, you can write these things down and discuss them with your doctor, but I would be, you know, a little bit worried particularly if they're selling something to you. What was the rest of the question?
Why the recommendation from the doctor might be different from what we Google.
Oh, so this is one thing that I would like to try to explain, and it's a little bit complicated, so I hope nobody starts snoring, but doctors, MDs, are scientists. We go to school for 4 years. Most of us do a science-oriented education. Then we go to medical school, which is all science. Then we do residency, which is all science. So when you come to see an MD, you're going to see a scientist. So what does science mean? Science means that it's been shown to be true by something called a randomized, double-blind, placebo-controlled study. Now, it sounds kind of complicated, but basically the point of these studies the point is to make sure that we try to remove as much bias as we can. So let's say Dr. A thinks that whatever he's given the patient is the greatest thing in the world. So he tries to get everybody to use it. So how would we determine if that was a proper thing or not? So in a randomized study, what you would do is you would have the patients put in different groups. So instead of being able to pick all the patients who were most likely to succeed with a typical therapy, you would randomize them. So you would just go A, B, as they came in the door. Double blind. Double blind means that neither the person studying the patient, nor the person entering them into the study, nor the patient knows what they're taking. So let's say the patient really likes their doctor and they think that they're on therapy. So they would be inclined to say, yes, I think this is working. You know, more so, they would believe that it's working better than it actually is. But if people don't know what they're on and the person giving them the treatment doesn't know who's getting treated and who's not, then it's more likely to be successful. And then placebo is just based on the fact that if you give anybody anything, about 28 to 30% of the time, it's going to work. So when we study things in this manner, we end up with what we think is science. Now, can it sometimes still be biased? It can. But when you go into a doctor and you ask them about an herbal supplement that has not been studied in this manner, and their eyes glass over, it's not that they're trying to be rude or ignore your question. It's that we don't really know how to think about that because we think of things in terms of science. Now, some doctors who have a lot of experience and have, you know, some intuition and who really pay attention to alternative therapies will be able to give you some information about what they've seen work in their patients and not work, and certainly advise you if something would be dangerous in your particular situation. You know, so if you're taking anything that's an alternative therapy, you definitely want to let your MD know so that they can make sure it's not interacting with other things that you're taking. But when you ask a MD about an alternative therapy and their eyes glaze over, please don't think that they're a bad doctor. It's just that they're a scientist and they don't necessarily know how to process that question.
I think there's so much in there that's such great advice about how to make sure that we're our best healthcare managers of ourselves. So you go to your doctor and you know what to ask and what to expect. I think one of the things in your book you say that a lot of us disregard, write down notes while you're with your doctor. Are there other things, and there's a lot in the book about how to take care of your own health, but what other general recommendations do you have to the general populace about how to manage our own health and our health care?
So finding the best doctor, One resource is to always ask your nurse friends. They know everything, and they will dish on the doctors in a minute. So if you know a good nurse, ask them. And then your primary care doctor, ask them, because your primary care doctor doesn't want to hear a lot of complaints. So when they refer to someone and that person does a good job, they're anxious to refer to them again. So your primary care doctor knows who a lot of the specialists are. And then, when you go to see someone, just use your common sense. I mean, if they tell you something that sounds crazy, you might want to get another opinion. But if what they're recommending pretty much, seems reasonable to you, then you're probably in the right place. So I would strongly recommend you use your intuition.
I'm not asking specific questions, and you all will be able to during the question and answer session, but I figure everyone has different issues, right? And the book is separated into chapters based on different issues. But somebody told me, and I'm not going to say who, it might have been my husband, it might have been somebody else, said, okay, when people are, about 20 minutes in and it's nice and quiet and people may not be paying attention, ask the doctor how many penises she's seen. And you will never ask me to do this again.
Oh, Lord. So I see one of my colleagues in the back who probably knows the answer to this, but oh my God, a woman has seen probably 250,000 penises. And because I'm a urologist, I can talk about the penis and they don't have to call the police, so this is good. We can actually, and it's actually one of my favorite organs in urology. So, all of the kidneys, the bladder, the prostate's a pretty good organ too, but I definitely probably like the penis the best. So that kind of leads into one of the points I wanted to make. It's a hard thing to talk about, but urologists treat erectile dysfunction. And, if you're under 55 years of age and you regularly have problems having an erection, that is a good sign that you could have high cholesterol or high blood pressure or vascular disease. So you want to start out with your internal medicine doctor or your primary care doctor to make sure there's not something seriously wrong with you. As far as occasional problems with erections, that's normal. I mean, that happens to all men. And then as gentlemen age, it becomes more and more of a problem. But there are so many wonderful treatments out there, and Atlanta is just full with great urologists, so really nobody should be suffering with this. The penis is fascinating because it has to have normal nerve input, it has to have normal arterial inflow, and it has to have a clamping down of the veins to keep the blood in there. So it's a fascinating organ. But because it is complicated, it can be affected by a lot of different diseases. So anything that can affect your nervous system, diabetes, Parkinsonism, multiple sclerosis, spinal cord injuries, can affect the penis. Anything that can affect the blood flow, anything that can give you vascular disease, anything that can give you heart disease or high blood pressure can affect the penis. But there are great treatments out there. So thank you for that question, Mary Ann. I'm going to get you later.
Thank you. Thank you for not kicking me out, but I figured you guys might be comfortable asking a lot of questions, but that might be the one that maybe I should bring up because it's, it's harder for people to ask that question. I mentioned all the stories in your book, and one of my favorite is she treats a trial lawyer, and like many great doctors, I presume, but I hadn't really thought about it before her book. Like many great doctors, she's got intuition, right? She's seen enough patients over the course of her practice that she knows when something's wrong. But when you're dealing with a trial lawyer, and trial lawyers may sue, it's a little bit more dangerous to rely perhaps on intuition. Tell us about intuition, its use in your practice, and its use to us as patients. When do we trust our intuition and when do we not?
So I'll tell this story, but my colleague, Dr. Kasabian in the back in the purple shirt, he is one of the best urologic prostate cancer surgeons I've ever met. So if anybody needs somebody, there he is right in the back. And he's going to think this story is a little too woo-woo, so he might want to cover his ears up. He's going to be thinking, we should have never let women in urology. But anyway, so I ended up seeing a lot of trial lawyers. And, for doctors, it's a little scary because our legal system and our medical system are a little bit dysfunctional. And I decided early in my career that I would just treat everybody the same. I'd do the best job I could, and I wasn't going to worry about what kind of job they had. So I had a lot of trial lawyers, and I had a lot of doctors, actually, for patients. But this one gentleman came in one day just for a routine checkup. His wife had said, you know, you want to go get a prostate check because your friend had prostate cancer. His examination was normal. All of his blood testing was normal. There was absolutely no reason to think that he had anything wrong with him. But I just knew this guy had prostate cancer. And I went home that night and I thought about it. His referral doctor was one of my big referrals, and I didn't want to do anything weird or woo-woo, so I was afraid to tell him. But I couldn't sleep that night. My conscience got the better of me, and I called him the next day and I said, this is going to sound crazy as can be, but everything's normal, but I think you have prostate cancer. Any urologist you went to see in town would not order a biopsy, but I'm thinking you might need a biopsy. So he says to me, I'm a professional. I know what it's like to see patterns in things and have feelings about things. And he said, I think I'd like to get the biopsy. So he did, and he ended up having prostate cancer. And he had it at a low grade and a low stage, and he was able to have surgery. And as far as I know, 15 years later, he's free from the disease. So I think all of us, that's a very dramatic kind of a example of it, but I think all of us have intuition about what's right for us. And I think if both the doctor and the patient, use that we would all benefit more from it.
I don't want to give the wrong idea about the book, and you'll all read the book, I'm sure, and you'll see for yourselves. There's a lot of very concrete medical information and advice, and she tells you where to look. Just personally, I'm very intrigued, and I figure for a general audience, not knowing what individual symptoms or problems might be present in the audience, those last 5 chapters, I want you to write a book just based on those last 5 chapters. I hope I see that in the future. But among the things that she tackles in those last 5 chapters is the role of stress, the importance of meditation, if you do that, what stress can do to the body, and how she saw it in her practice. So can you talk to us a little bit about those general life management techniques?
So we'll talk a few minutes about stress. So what is it? So when we lived in caves and the guys had to run out of the cave and fight the tiger, our nervous system was developed to be able to just really increase our sympathomimetic hormones so that we could clamp down our arteries and be ready to fight. Well, in modern times, we don't have to do those kinds of things, but the body doesn't really differentiate between I had a fight with my wife, or boy, my boss is a jerk, and these other things that were true stress responses. And so in modern life, we become kind of chronically stressed, which elevates our cortisol levels, which can decrease our immunity. It can cause us to store fat at a faster rate. And fat cells are not sitting in there doing nothing. They produce toxins. And all the studies show that if we're way above our ideal body weight, that we're more likely to get cancers of all types. So taking care of ourselves by getting good sleep, which can decrease our cortisol level, getting exercise, which can decrease our cortisol level, eating good quality food. I mean, all the things that we know that we all learned by the 8th grade. And then we're presenting a body to the medical system that they can actually work with and be able to do more with.
Before I open up to audience questions, because I think you guys may have better questions than I do, is there something I haven't asked that you'd like to answer, or something that you'd like to bring up that I forgot to ask about?
So I just want everybody to know that the future is bright. People make fun of the younger kids in medicine because, they're different than my generation of doctors. But the good thing about them is they share information. They collaborate, and things happen faster with them. A guy in California will report what happened in his lab to some guy who's in Hong Kong, who's reporting it to some guy in Australia. So the young kids are very clear thinkers, and they're very good communicators, and they collaborate a lot better than our generation did. I mean, we would do a research project, and we would hold on to that because we wanted to be able to publish it in a journal. And so it might be a 2-year cycle before our information really gets out to our colleagues. And these kids are so yappy, they'll be telling somebody, in 15 minutes, hey, my rat did this, and the next guy will be making a change in what he's doing. So the future's bright. And I think, with the technologies of blockchain and the internet and gene therapy, CRISPR therapy, I think things are happening exponentially. When I decided to be a urologist, we were doing open surgery for kidney stones. We would cut people from their belly button all the way almost around to their spine. I mean, they would almost be like cut in half. And they would be, out for months and months and months. And I actually loved that kind of surgery, and it was one of the things that drew me to urology. But by the time I had become a urologist, a really smart engineer had figured out how to break kidney stones up with lithotripsy. And so rarely did we do those open surgeries anymore. And so that happened in just a matter of 4 years. But information technology is happening so much faster now. And the thing I want the audience to think about is your doctor is busy working between 60 and 80 hours a week, using the information that they have at this moment in time to take the absolute best care of everyone that they see. They may not have the time or the communication levels to know what someone's doing somewhere else. So if you come across something that you think is interesting, by all means, try to look it up, read about it, and talk to your doctor about it, because about once a week, someone would come into the office and tell me about something that I did not know about that turned out to be, an important thing for me to know. So just be aware that information is moving and technology is moving faster and faster and faster. And so the future is bright. And when you go to your young doctor and he turns his back to you and starts typing in his computer, it's not a personal affront. He or she might have little different communication skills. And if you're a young person and you go to your old doctor and they can't type worth a hoot, just realize they've been dictating for 40 years. It doesn't mean they're stupid.
Now, I have a list of some more specific questions, but I think we'd like to open it up to the audience. And you can ask anything specific or general or whatever you might like. If you'll just speak in a loud voice, and Martha will repeat the question and then try to answer it for the audience.
In the last 6 months, I have had several extensive tests. On neither occasion of those tests could I get hold of the doctor to speak to me directly. Do you feel like there's going to be an improvement in some fashion, or are we as patients supposed to be doing something to help with that communication? I felt like I was just dropped, and it felt very uncomfortable to even go back to that person. So have I misread what their intent is?
So I don't think any doctor intends to order an expensive test and not have the patient get the information. What I would advise you to do is probably make an appointment and go in and sit down and talk to them. I mean, our system is being inundated with all kinds of rules and regulations, and they've gotten to a point where they're almost absurd. I'll tell you a funny story about that. I was getting ready to operate on this Georgia Tech student who was just a brilliant kid. His mother was actually a trial lawyer in San Francisco, and he was urinating blood, and he was writhing in pain, and we were going to do emergency surgery on him. And the poor nurse had to ask him all these questions that were on this list that were government and insurance industry dictated. And one of them was, do you feel safe at home? And he's doing like this, and he's going, of course not. My frat brothers drink all my beer. And I turned and looked at the nurse, and I said, put that in the chart. They need to know how stupid these questions are. So our time is being really inundated with things that we don't have any control over. And if we don't do all this stuff, then your bill won't get paid by your insurance carrier. So it's a bit dysfunctional, and certainly if you have a test and you can't get the information you need, then I would make an appointment. And when you make the appointment, just ask the doctor what the pathway is in their office. How do they like to handle getting test results? But I wouldn't run off just yet.
Any more questions? Anybody have a specific or general?
I don't have a question, I have a comment. Normally I would not say this because my husband is unfettered when he speaks, and you opened it up. I was telling him where I was going today and said, you remember Dr. Boone, and because we'd gone to her for years, and he said, oh yeah, she's the one that used to play with my pecker.
Oh, Lord. So, good thing I'm not still working for Northside. I probably would have been out of there.
I obviously asked the question the wrong way. It should have been, how many peckers have you played with? In the book, there's a very interesting use of Botox. Tell us about what's in your book about Botox.
So urology has always been on the forefront in technology. The gynecologists were the first to really use laparoscopy and to do big surgeries with laparoscopy. So they were kind of leading the way. But in other technologies, urology was really always technologically ahead of a lot of specialties. And so we'll try a lot of things. And one of the things that we tried was for overactive bladder was to put Botox in the bladder. Now, the first 5 or 6 years that this was being done, I thought, this is a bad idea. So I was a little slow getting on the bandwagon. Then one of the urologists here in town that I really trusted was on some of the original studies, and I sat down and talked to her for a long time, and she said, it's working amazingly well. So the same stuff that, docs put in your face to get rid of wrinkles, we would put in the bladder. And when they put it in the face, it seems like most people report it lasting 3 to 4 months, but for whatever reason in the bladder, it would seem to last 10 and in some patients 12 months. So particularly in patients who are spinal cord patients where the bladder would just contract and empty on its own, it was a miracle for them. I mean, they could get their lives back. People who had not been able to go to work because of incontinence issues were able to get back into the workplace with using Botox. So it was a strange application, but it is working amazingly well.
Any more questions out there? Yes.
Dr. Boone, you're a trailblazer in many respects. What regrets do you have about the time, the period that you came up through in medical school and the difference that you see today for women?
What regrets do I have?
If any.
So I don't really have any regrets because I kind of don't think like that. I'm looking forward. I'm looking, where's my ball going next? I'm not looking back. I get a lot of questions about being a woman in urology. I was a urologist before I saw a woman urologist, and all my mentors were male. And in the early years, surgery, particularly general surgery, it was hard. But I honestly don't think it was any harder for me than it was for anybody else. It was tough for the guys too. I mean, we were at the hospital 70, 80, sometimes 100 hours a week. And so the people who chose to go into surgery, particularly during that time, I mean, we really had no lives. And for the women, it occurred during our childbearing years. So trying to have children during that time would have been, fairly impossible. And you certainly would not have been able to do a good job for the kids unless you had a gentleman, our partner who was willing to stay home and take care of them. But I really have no regrets. I absolutely loved being a urologist. I had great mentors all along the way. And as far as the guys go, I think I gave them more trouble than they gave me. Wouldn't you say that's true, Dr. Kasabian? When I went to New Orleans after I had written my first book, in my novel, there are some male doctors who give the female doctor a lot of grief, and there's one guy who's particularly bad, and he's modeled after a couple of fellows who are difficult. And it was interesting, all the guys thought they were the good guy. None of them thought they were the bad guy. And when they came to visit me in New Orleans for one of my book signings, all the guys that I had trained with, they came and they brought Clinique soap because I had had that in the bathroom and the call room, and they knew not to wash their butt with my face soap. And they would pass that down to the new guys. When a new intern would come in, they'd go, "Don't touch that soap, whatever you do." So the boys brought these bars of Clinique soap with pink bows tied on it to my book signing. And it's kind of interesting, the American Urologic Association was our governing agency was very concerned about the experience of the women in urology. So they would send someone around every year to check to see, how I was doing and what was going on. And every year I had done more cases than the other two guys my year. And it was because of the nurses. The nurses would feed me a lot of the good cases. So I actually think being a woman in urology ended up helping me. But a lot of the organizations that I speak to, they don't like that answer. They want me to say the guys were terrible, they did awful things to me. They played jokes on me, but I played jokes on them too. So I really think that it was actually to my advantage, and I have no regrets. I loved every minute of it. She's talking about a technique called neuromodulation. We've been doing that since the 80s, and this is kind of another example of where urology has been on the cutting edge of technology. And it's actually very commonly done now. We make a little tiny incision above the hip bone, and we feed a little electrode. It's kind of the same technology as a cardiac pacemaker down to the bladder nerves, and it changes the nerve impulse to the bladder. And it can work miraculously well for people who have overactive bladder and urge incontinence. And there are a number of groups in town that do a really good job with it. I started doing them in 1985, and we got a lot of good results with it.
More questions? I do want to say something about The Big Free, since you mentioned that. If you haven't read The Big Free, I love that book. You'll laugh, like Unfettered Urologist, you will laugh and you will cry. And if you want to know more about what it was like to be one of the first women in the field, I think that book is at least loosely based on your real life experiences, and the protagonist there goes through all sorts of things. Tell us about the sequel to that book, Mother Charity. When does that come out, and how can we get a copy of your third book?
So my third book is the sequel to The Big Free. It's coming out March 5th, and I'm really excited about it. It's basically the second 6-month period for the young doctor, and there are lots of crazy stories in there too, and it's based in Louisiana, which I love Louisiana, and I love Tulane, and I love Charity Hospital, and so all those things are in the book. Yeah.
I think if there's nothing else anyone has to add, we want to thank Dr.
You have one more question?
Oh, yeah.
I wanted to ask a question about what do you...
So you can't really know.
Okay.
I mean, it's to me, that's kind of like what makes something a professional, The person you're going to, whether it's your tax guy or your lawyer or your real estate agent or your doctor, they have specialized knowledge. And so to some degree, you have to trust them. So you trust your intuition. And then you can find information like this device that she's talking about is made by a company called Medtronic. And on their website, they'll have information. Now, granted, they're selling you something, but they are a very reputable company. And for the most part, I have never seen them really lie about their results. They pretty much report what happens nationwide. And, you ask people who put them in. If any doctor ever tells you they have a 100% success rate with something, get away from them because they're psychotic. We're human beings. Nothing works 100% of the time. And, a good doctor will tell you, this is what, usually happens when I do it. And I mean, what I would do with my patients is I would tell them who the best person was in town for whatever they needed. I mean, like Dr. Kasabian, who just left, if someone had a complicated cancer, he's the guy. And I would not hesitate to send one of my patients, to him, or they would say, who would you go to for X, Y, or Z? And, I would tell them, and sometimes it was me, and sometimes it was somebody else. And, I mean, no competent doctor wants a bad outcome. So they're going to use whatever, resources they have, if they have any sense. Anybody else? And you guys have been a great audience.
Yeah.
Thank you.
Thank you, Dr. Boone.